Welcome to Aging Untold. An annual checkup can turn into a long list. Labs, screenings, scans, and even with insurance, the costs can surprise you. So how do you sort through it all? A lot of it comes down to your age, your personal risk factors, and what makes the right sense for you right now. Dr. Ray, when patients feel overwhelmed, what's a simple way to prioritize what to do now versus what can wait?
So I think the biggest thing I would say is take the time before you go to think about what it is you're expecting so that you can be proactive. And think about it now. It used to be that the doctors just told us what to do. We would just do it. Well, it needs to be a partnership, and you need to have some say in it. So are you going because you're going for your well woman checkup, or there's guidelines for screening based off of ages, or are you going, or personal history, family history, things like that, or are you going because you have symptoms or something? So first of all, is it a screening, or is it a diagnostic test, or you need further tests for follow-up? So, but you are a participant. So don't let them throw everything at you. There needs to be a why we're doing it. You have a lot to say about what's going on, and don't just settle for accepting whatever somebody tells you.
Right.
Right.
I think finding out what's going on with you, like you said, but then looking for trends. So getting some baseline tests early enough when you're healthy enough that now we have a comparison later on down the road, and that we don't do that often enough, I don't think.
Well, I think they do in the guidelines. So I think that's why when people come for just basic certain labs, I think that's what they're doing for the guidelines.
Right, but there's some things that we're seeing that are showing up more when we're aging, and we haven't tested back here, and so we don't have those original baselines, and those are important to try and get on board.
And I think that's where the family history and the personal history really zones in, because that individualizes it, so you're not just doing it based off you're 40, so get X.
Right.
I'm so glad you're saying that, because I went to the doctor and she went through a battery of all the tests and procedures I needed to go through. Well, I sat there and I felt overwhelmed, and I thought, I do this for a living. Like, why am I sitting here feeling overwhelmed? I shouldn't feel this way. So if I am, other people are too. But then when I got home, I thought what she didn't say is your ears need to be checked routinely. Your eyes need to be checked annually. Your teeth need to be checked. Like all the things that she didn't say that I thought we don't think about.
What happens when you go to the doctor's office, we don't even think about that. We think about, well, let me look at your blood pressure and your temperature. And we don't think about the other things that are just as important. Oh, or did the screenings. I know, we'll say, well, have you had your mammogram? I don't say, have you had your eyes checked?
You're your best health coach. And so you've got to get what you need out of all the different professionals out there, and also kind of take charge of your project, which is you. Take good care of yourself.
And don't forget your skin. Like, think about your skin and the places that you can't see, and maybe you've got a bump or a lump or a coloring difference that means something. You don't get that at the doctor unless you go to a dermatologist specifically to get examined.
Well, and be an advocate. I had a really close friend who lost her mom, to colon cancer, and she was in her 30s, and she wanted to be screened, and the doctor kept insisting, "You're not old enough." And she's like, "No, I feel like there's something."
Right.
Well, what are your symptoms? I just want to be screened, and she kept pushing and kept pushing, and thank God she did. She actually was early stage colon cancer, and they caught it, and she's lived a long life. But had they let it go until the regular screening date, 50?
Well, and they're moving it up now.
And now they're moving it up. So she would have had, almost 20 more years before that normal screening, and that could have, just
would have never made
it. It just comes down to, you have to listen to the person.
Yeah.
Many people are in tune with their body. They may not be able to identify what it is, but they know something is off.
Something's wrong, and be an advocate. Our aged community really has learned that whatever gets said in a doctor's office is that's it. Yeah. And they don't question. And so I love seeing that some of the younger folks are coming in and they're like, no, we're not going to do this. So
I think you should also ask. I tell people, when you're going to go to the doctor's office, ask them what are the current guideline recommendations for my age.
Right.
So you can participate.
Right.
And then add your family history and say, knowing this history, what else would you add?
Right.
Yep. if I was your mother, what would you want me to have? I think
Thank
that's
you.
always a good question to ask. What would you do for your mom? What would you suggest for your dad? And then the opposite end of asking questions is, I don't know what the doctor said. And so take somebody with you and both of you ask questions.
So I know just like in general, usually in terms of women, gynecologists, most of the time it's your pap smears, age 21. Mammograms about age 40, but you have to also take into family history. Colonoscopies age 50, but they're moving that down. Bone density scans, usually at age 65, although I say whenever you lose estradiol, you need to be looking at the bones
Right.
and all that. And then in terms of the men, I think some of the prostate screening and all that, 40 or 50, but that's under debate too. So the guidelines depend on what agency they're looking at. And so everybody has a different agency. They look at different guidelines based off of ages. And then anytime you throw personal history or family history into it, it usually knocks that down even lower. And then you have the recommendations for vaccines and all those different things that are out there. So I think it really is, you really need to ask your physician, what are the current recommendations from the different guidelines for my age?